Great. Welcome everyone to our Mystic Health webinar. Just giving a moment for people to trickle in. We have a really special webinar for you tonight. My name is Houman. I'm the founder and chief medical officer at Mystic Health. We are a holistic health practice operating in Santa Monica, and really happy to introduce our guest today, Haleh Keypour, who is one of our in-house psychotherapists. It's been a real pleasure and honor to have her as part of our practice. I should thank Leonard Byrne for making this introduction and for adding this wonderful piece to our practice. Part of our vision with Mystic Health is providing culturally attuned care, and that it's a topic that's really dear to my heart, and an expertise that is important in mental health, and especially when dealing with intimate psychotherapeutic work, which we aim to achieve at Mystic Health. So it's a big honor to have Haleh here. She's a gifted psychotherapist, someone that I hold in deep regard. She has over 2 decades of experience working with trauma, in mood disorders, working with substance abuse, and intergenerational trauma patterns that run deep. So she comes from an Iranian immigrant background like myself. She's worked in diverse settings, including at UCLA, Planned Parenthood, and has a compassionate and nuanced approach that is culturally fluent. So, Halijan, thank you so much for joining today. If you can please introduce yourself and perhaps tell us how you got into doing psychotherapy in the first place.
Thank you so much for this very kind and generous introduction, Houman John. Um, I became interested in psychotherapy because I was always very interested in reading people. Um, it's so much so that sometimes it was a bit uncomfortable that I could see one thing that people were presenting and another thing that I felt was actually going on. And that is not always very polite in the Persian culture to call on, but psychotherapy actually gave me a sense of freedom to express that. I uh, flirted with some other ideas of careers and stuff, but really what was my calling. And also, I think some of the pain and trauma of immigration really offered a sense of home and belonging in psychotherapy, which is why I'm here today. And I feel extremely lucky to be a therapist. I feel very lucky to do something that I feel so joyful being in and out of every day. Um, I took some time off when I had my family, young children, but I always had one foot in the door and keeping the work and keeping my license, and I'm back doing it pretty much on what feels like full-time business to me.
Great. Yeah, it's such a privilege to have passion and love infused in our work so that, our work and the rest of our life are not separated. And so the fact that you enjoy doing what you do, I think, impacts your influence on your patients. And yeah, I try to sort of live by those principles as well. I'm wondering if you can explain a bit in terms of your immigrant background, how that shapes your experience as a therapist, and what unique features you see when working with immigrant populations.
Um, I moved to the States in 1985. I was among the second group of immigrants that moved out of Iran. A little bit later, we can talk about the patterns of immigration because there's three waves of immigrants that left Iran. I was among the second pattern of immigrants that is post 1979 revolution. But also, I left at a later time, post the revolution, than some of the other people from my culture. I come from a Jewish Iranian culture. Minorities after revolution were under persecution and under pressure. Political opponents to the regime were also among the minorities, Sunnis, and there are many group of minorities that were under oppression at that time and felt threatened. A lot of them left directly after the revolution, 1979, 1980. But then 1980 is when the war happened and the borders closed in Iran. So I left uh, about 5 years into the war. And by the time I left, I had a strange kind of mix of enough of Iranian culture in me that I was able to speak and express myself in Farsi, and I had enough knowledge of the literature that I could converse very comfortably. But at the same time, it was too much for people who couldn't really put me and someone like me in a box because a lot of people were younger when they left. People who are my age in America had left America a lot younger. They left when they were 5, 6, or 7 or 10. I was 16. So in that way, I was a little bit on the margins and I was a little bit kind of othered. And to find my footing, uh, it was kind of challenging. Um, there's a sense of immigration shame that I think comes with many of us. For Iranians, it was even more profound because the 79 revolution brought with it a major host of problems. There was an invasion of the American embassy, the hostage crisis, and that really tainted our the view of the Iranians in the West. Um, so that was already embedded in the immigrants that had already left Iran. And for me, that plus just being a little bit different from people of my generation who already had moved to the States was awkward. On the one hand, I wanted to quickly assimilate and be a part of the American culture. On the other hand, I felt extremely loyal and physically still very tied to the Iran I had left behind, especially because my family was still left in Iran.
I see. So I understand where you're coming from. It's complex in a sense. You're leaving a place you're attached to, being persecuted there, and then also coming to a new place where you face these new pressures as an outsider. So I think this sense of being an outsider in many places is something that a lot of us Iranian immigrants particularly have dealt with. So I'm wondering, how you think that's influenced the culture, this pattern of immigration and the cultural shift, the identity shift that really took place after the revolution and the immigration diaspora process.
Yes, well, um, the way that I see a major shift that has affected the Iranian culture was, of course, coming to the West, where a lot of the traditional values were being questioned. This, I think, was a little bit more difficult for the men, Iranian men, especially of the older generation that had to come here and immediately pivot into getting demoted from the sense of authority, respect, and position they held. Um, and also that not only their position was questioned, their spouses and the women and children in those families became they kind of uh, they were elevated because the women had to work, children became their languages, and also they were doing a lot of the transactions and translated for them. They had rights women and children had rights, which was not really something that Iran had at the time, or at least it was dismissed. So that kind of shift was very dramatic and very abrupt for men, and very difficult to tolerate. I remember, I don't know if we see that as much anymore, but of course, Los Angeles, that has a very big population of Iranians, you would see Iranian men still in suits going to the supermarket, which was very symbolic and telling of how they still wanted to embody that sense of authority when they stepped out of the house, and the connection they need to um, hold to their identity as the man of the house. So that was a major shift. Some of the other another area of change was the external veneer of Iranians, which is a very embedded aspect of the Persian culture. We always hold ourselves uh, gracefully. We have to be very polite. We do a lot of tarof, and I can get into that if you want. We have to present well. We have to present successful. And all of those were being challenged by the drama of immigration, the size of the homes, the demotion, the doctors and scientists and engineers that came here and had to start over, or not even able to succeed and pass the exams. Those were all shifts that were very, very dramatic to the culture. Um, Talked about this social ranking. Sorry, I do have notes that I need to go back to. The other thing I wanted to say is, and I think that that's true for a lot of immigrants, we became a very hyphenated population. We became Iranian American, sometimes Persian American, sometimes Persian. We became Jewish Iranian American if you wanted to be identified or validated in certain groups, or a Muslim Iranian uh, population, Zoroastrian, since there were a lot of issues also, again, with terrorism and associations with acts of evil, that people wanted to decontextualize themselves from the axis of evil. So that was another area of shift that occurred in the Iranian immigration population here. I hope I answered your question.
Yeah, yeah, please. Very informative. Thanks. You mentioned men particularly having a hard time. I know that, vulnerability and the expression of it is also something that carries shame and is difficult. Do you have Iranian men in your practice? What's the ratio like? And, how have you found dealing with, this population?
I don't have Iranian men in my practice, and Iranian men traditionally hold back from going to psychotherapy, exactly for the reasons we both mentioned, and shame is a very big factor in this. Overall, psychotherapy carries a lot of stigma with it in the Iranian population. Now, the younger generation is more open to it. There is more desire in that population to seek that psychotherapy. But for men of older generation, no. However, if they feel that there is a sense of short-term or solution-based psychotherapy, or even family therapy, because the generations are very important in Persian culture, then maybe if they come in as a group or as a couple, that becomes more inviting and a safer place for them to attend therapy.
Interesting. Yeah, I mean, I've found it to be very similar. There's that stigma, and certainly difficult to let go of the status. And I think what you mentioned is valuable in that if we have a more sort of goal-oriented, perhaps short-term approach, which, in some ways, something like psychedelic-assisted therapy with ketamine could facilitate, it might be an attractive option. And one of the phenomena that's taking place in the psychedelic medicine world is this separation of therapy from the medicine. And I can see how that would be attractive for, let's say, Iranian men who don't want to do the therapy, but would be willing to do some sort of medical sort of treatment. I'm wondering if you can expand on Tarof. You mentioned Tarof. It would be cool to cover that.
While I was doing a little bit of research on the concept of Tarov, um, it might be something that you guys want to explore a bit more and search the web. The tariff and Tarov, as a matter of fact, come from the same root. So it's a little bit harder to explain the connection between those two, but I'm going to stick to Tarov for the time being. Tarov is a term that is particular to Iranian. The experience of it is exclusive to Iranians. It is, in a way, an overarching experience of being an Iranian in many ways. It is the pleasantry. It is about offering and deferring to somebody else's benefits and needs. It's about the sense of selflessness. It is, I have a lot of notes about Taro. It is a lot of back and forth, frankly. The politeness is expressed through Tarov, and this back and forth is a difficult one to navigate because unless you're Iranian, you don't know when to back down with Tarov and when to surrender to it one way or another. Um, it is more defined with the older and the younger generation. Like the older generation, when they do tarof and they offer you something, you say no. They offer it two or three times. Then you say thank you, and you have to take it with a sense of modesty. But it is a very much a domineering concept and dynamic that plays itself in many areas of the Iranian culture. Taarruf can happen in psychotherapy. The patient can come in, bombard you with a sense of compliment, and they want to give you gifts or they want to shower you with compliments of such. And you got to kind of understand that this is part of the pleasantry. This is part of the even listening to you, making you feel that you're heard as a therapist is part of the Taarruf concept, I think. We can understand it, I think, in that context. But it is also a way um, to kind of still hold on to some sense of defense mechanism against showing vulnerability. Um, so we can go into more details about Tarot, but overall, this is the meaning of it. And I think that this is a very important concept to keep in mind. If I can just share a brief, funny story about this. I don't know if any of you remember, Tori Spelling had a show for a short amount of time. She had a show, and one episode of it, I think it was, I can't remember the name of it right now. One episode of it, she has an Iranian friend and she goes to their home and she sees a rug and she says, "Oh my God, that is so beautiful." And the family, the mother of the friend says, "You should take this." She does the tarot. "You should take the rug." She says, "No, no, what are you talking about?" "No, please take it, take it." So she insists. Tori takes it. And then the family is baffled and so insulted that she accepted this gift, expensive gift, in the exchange of tarot because she had no concept what this meant, but the insistent made her feel that she was obligated to accept the gift. So it is extremely nuanced, as is this culture, and that is pretty much in a nutshell what tarot is.
Thank you. Yeah, I have my own challenges with Tarof. I think there is that beauty and modesty, but it makes communication challenging. And like you said, sometimes you don't know where to draw the line. And yeah, I find that in truthful and unfiltered communication, you sort of have to put Tarof aside. But it's a great example of, the importance of culturally attuned care and knowing, who you're dealing with to be able to better understand what sort of communication is taking place. How do you feel about it generally? Have you had any positive or negative experiences in therapy, with Taro?
Um, I'm very aware of it. I also, in some ways, I feel like I'm a little bit abrupt, just my personality, so I feel like I kind of have to break that barrier quickly. I remember initially when I worked with some Iranians, the thing of Tarov also um, was associated with how we address people. Similar to the French language, you say you address you as the person who's a stranger to you in plural. This is a form of respect. The French also do the same thing. They say vous instead of tu. Tu is friendly, vous is not. So we address older people, we address strangers. We address people that we want to show respect to in initial meetings as such. So I wrestled with that a little bit at the beginning of some of the work I did with Iranians, but quickly I forced myself to accept saying to the you. So I could get rid of the barrier, and I could also position myself in a sense of authority, in a placement of authority, which I think for Iranians is also very important. Iranians care very much about authority. Doctors are the authority. Sometimes they call me doctor, and I'm like, I'm not a doctor, I'm a psychotherapist. But they are more comfortable calling you a doctor because they want to feel that they're under your care, that they're being taken care of, and that you know more than they do. So it is nuanced. You still have to be mindful of it in the work. But yeah, I think I kind of cut through it a little bit.
That's interesting. Yeah, I see where you're coming from, and I can see the value there. I guess perhaps even practicing as a woman, it's important to establish your authority in this therapeutic framework. I'm wondering if you can talk about some of the intergenerational effects of just the culture, maybe the immigration, maybe religion. How do you see that playing out in your clients?
Sure. Um, just briefly, the first wave of Iranians major wave of Iranians that left Iran for the West, they were mostly students. That was during the glory days of Iran. There was the economic success of what the Shah wanted to create. And there was a need for higher education that at that time Iranian educational system was not able to provide. So a lot of middle class young men and sometimes women, middle to higher class, went abroad to achieve higher education with a plan to return to Iran. So that group of Iranians, in some ways, is actually oddly more assimilated and more acculturated than some of the other groups that we see that came post-revolution. Um, uh, in psychotherapy, when people come in, some of the difficulties they present is the attachment and they're passionate people, but they also are very passionately connected to their defenses. So to work through that can be sometimes a frustrating experience. And what are the defenses? The defenses could be the intergenerational connections they have, the sense of betrayal they might feel if they express emotion that is not aligned with their family values, or they might say something about an elderly or a parents that they feel uncomfortable with, or they might actually really be in a different place in their acculturation than other generations. I'm talking about some of the younger people that I have worked with. So that becomes difficult. Also, the younger generation who's interested in seeking psychotherapy can be in conflict with the older generation. Older generation can be very traditional in terms of how they want to approach life, dating, marriage, and all that. Younger generation not so much. Now that we have come a very long way, even from 10 years ago, so much so that more women are becoming educated, more women are studying independently or having their homes or choose their partners. But that wasn't not really so much the case even 20 or 30 years ago. So we have come a long way, but you can see the effects of that still very much prominent. The conflict is there. One way or another, the conflict is still there between the generations. One other thing that I wanted to um, point out here is the generation of my grandparents, which is about 100 years ago. Uh, many many couples were in arranged marriages. And a lot of the times, these arranged marriages were within the family, really relatives, because that's where the trust was, that's where the negotiations happened more comfortably. And there were also sometimes child brides that were involved in these marriages, people married younger. So there is that effect of trauma that we need to keep in the back of our minds because if, for example, that parent struggled with their own feeling of imprisonment in a marriage that they could not leave, or suffered some depression and anxiety, which, by the way, many times Iranians that come to therapy, they somaticize a lot of their emotional pain. So they carry that truly. You can see in their posture that they carry that with them. So the grandparent that suffered some of that trauma raised families that became very rigid, or children that became rigid and one way of thinking about how things should be done. And that effect can be felt by the younger generation. So to let go of that, that takes negotiation. To let go of that, that takes explanation, because it could be perceived as abandonment or absolutely just being dismissive of the older generation.
Wow. Yeah, I totally resonate with what you're saying, and these passed down patterns, the parts of ourselves that we don't typically get to work on, a lot of times get passed down to the next generation, and it's someone that has to do the work for themselves and probably for the ancestors. You mentioned the defenses, and one of the things that's many people face in psychotherapy is the difficulty in letting go of the defenses. So I'm wondering what your experience has been, and how do you help people disarm the defenses to actually do the work and feel the things that need to be felt, say the things that need to be said.
I think it is important as a therapist to emote a sense of authority, that you know what you're talking about, but you don't know a lot. And Iranians sometimes feel like people don't understand them. From other cultures, they feel like people don't understand them. So it is important to really um, be very open to learning and understanding without really losing your position or seeming vulnerable, which it's this strange duality that it incorporates. But it's, sorry about the background of the dog noise. So it is something to be aware of. It is something to be sensitive to. Um, so uh, in I'm sorry, repeat the
It's more
this.
like, how do you help people, um, you know,
Oh, defenses.
pass the defenses? Yeah.
So it is important for them to have language to express themselves. So we might sometimes have to even teach them the language for where they feel the pain. You know, are they feeling pain? Are they feeling anxiety? Are they feeling sadness or depression? Are they feeling excitement, or are they feeling anxiety? So it is important to help them develop a language that they can express themselves. And then to also really see what it is that could be that, that someone like Leonard, who is an analyst, is very well versed in the expression of the sense of danger when you're confronting defenses. What is the danger? What is the risk in letting go of some of that, of letting down the wall, of letting go the defenses? What could be at risk? And a lot could be at risk because for some, letting go of some of these defenses could mean that they could lose their family, that they could lose their place in their position in the family, or that they might devastate their mother, they might destroy their father. So those are important to be aware of in approaching these defenses. Be gentle, but be inquisitive and curious about it, and engage them in the curiosity about their defenses. I think that that's actually really important.
Yeah. Do you do you have a somatic approach? I mean, I think you're spot on in terms of, how much is stored in the body, especially with, the Iranian community. How do you address that? Do you have any sort of somatic work that you do?
I don't do somatic work because I'm not trained in it, but I can be observant of their body language and depending on how comfortable they are and uncomfortable they are with pointing it out, note share with them my observation of what it is I'm noticing. If they're not leaning back, if they're at the edge of their seat, if they're holding themselves and if they're just kind of crouching, or if they're breathing fast and hard, if their speech. So all of these could be something that we can observe and be inquisitive about, again, more gently, because again, they're very prone to shame. Iranians are very prone to shame, so it's important to be very mindful as we gently inquire about that.
Yeah, that's that's very appropriate. To explain a little bit about how we do psychedelic therapy, it's really a combination of everything you mentioned. And what we believe in this framework of psychedelic assisted therapy is that there is an inner intelligence. So the same way that, your skin heals, your immune system fights disease, there's this inner intelligence in our psyche. And so if we facilitate the right environment, it will automatically unveil and push content that is useful to be processed. And a lot of times in psychedelic therapy, if we hit like a roadblock and a person is not fully able to tap in to the emotion, we end up going to the body and actually going to the body, going to where the tension is, going to where the pain is literally tied to a stored memory that then unfolds. A lot of times a memory that's, in childhood. And that's when a lot of these defenses are formed, as you know. And so, but that does require delicacy, like you said, because, defenses are there for a reason after all. And getting rid of a defense after decades leaves people in a very vulnerable place. And so doing this work is definitely very sensitive and it requires the approach that you mentioned, actually.
Now that you mentioned this also, John, I think something that I think you probably you're equipped to offer the patients, especially of older generation, with their defenses is music and poetry, because that is also very much an extension of the Iranian culture, and people of the older generation are very familiar with it and they resonate with it. So I think that that's also an important way to channel some of the subconscious with them.
Yeah, thanks for bringing that up. Music is a big passion of mine, and I love poetry. I find it challenging, especially traditional Persian poetry is just more sophisticated, and I often require help to understand it. But bring being able to bring that into the therapeutic environment is a major privilege. And I've used it both in patients that understand the lyrics, but also in ones that don't. And so, reading translated works of Rumi, for example, which has such rich and beautiful spiritual guidance, has been really powerful for many patients. And listening to the music, for example, like Shajarian or Nazeri, these people that sing so beautifully, has been impactful for a range of patients. One of the approaches to the use of music in psychedelic therapy is to use lyrics that the patient doesn't understand, so that you're not engaging their language centers and not intellectualizing the experience and making it more transcendent and somatic. But I think in this case, it's actually very useful to tap into that space, and especially because it's such emotional music, and it's often the buried emotions that are, coming up in the form of pain and in the form of anxiety. And so helping people tap into that and express it, and this catharsis of bottled up emotions is what I found to be most helpful for people.
Yes, all those musicians you mentioned, their music is very melancholy. There's a sense of longing that I think is that sense of melancholy is also very much embedded in the psyche and the mind of Iranians. And on the one hand, they hold on to it very tightly because it's also a good thing to have. You're not supposed to be too expansive. On the other hand, it's something they suffer from. So it does open up a lot of that, and I think brings up memories and that sense of longing that I think could be become useful as a tool in psychotherapy and the work you do.
Yeah, exactly. I'm wondering, why do you think our music is so melancholic? Like I think it's ours is just particularly sad, and I'm wondering if you have any thoughts on that.
I Whatever I say is going to be just my own interpretation of it. Um, I think we need to be able to express because we're not even though we're very expressive people, um, it's not polite to express ourselves so openly. So I think music and the melancholy of music really gives an outlet for us to express ourselves, and it is also very much intertwined with the music, with the religious music that we hear. A lot of the azun, the Muslim calling for prayers is extremely melancholic, and I think that even me as a Jewish person, when I hear it, I get goosebumps, and Iranian mu religious music is also very different from the non-Iranian Jewish religious music. And I resonate with that a lot more. There's a lot of flat notes in that naturally brings up a sense of sadness, and it gives space for people to express themselves. Culturally, even though Iranians are in a battle with themselves, with the religion and the authority that is imposed by religion. There's a lot of cultural gatherings and sofre or such that calls people to come in and they listen to sad music or prayers, and it's an opportunity for them to also cry and get connected with their own pain through this venue that is more appropriate or culturally accepted.
Very interesting. Yeah, I think another idea is, when looking at sort of Sufi mysticism, and I'm not an expert in Jewish mysticism, but this notion of being separated from the beloved, There's this sort of heartbreak,
Hmm.
if this idea of let's say this life of ours being a drop that's left the ocean or a wave, that's going back to the ocean, this longing and desire for reunification with the one. I think that's also a part of it, but you're very right that we have these bottled up emotions really, and we need an opportunity to let it out. I think it also ties in with the Taarruf, not fully expressing ourselves is almost part of that Taarruf culture of we're not supposed to do that.
I would
Yeah.
agree with that.
Have you have you ever used music or poetry in your practice? Is that something um, that I think, in talk therapy, it's hard to do that, especially if someone's coming to see you with a limited time. I'm wondering if you've had the chance to do that at all, like using poetry or something of that nature.
I haven't used it, but there are times that I might all of a sudden, in a moment of conversation that a thought crosses my mind about something in Farsi or ضرب المثل. Uh, how do you translate that in English? Es, es,
It escapes me.
oh, it's like a symbolic expression of something can come to mind. And I use that part of my culture in using that as an example of something that sometimes cannot be expressed in the moment. So in that sense, I do. Music, no, but maybe, there's time to time, I have come across situations that somebody shared something with me musically and I shared with them something musically, but not necessarily as an approach, but more in like a moment that calls for it.
Listen. Yeah, I guess proverb is one way to put the Zabur Masad.
Hmm.
Yeah, we have a rich selection of proverbs in Iran, and I don't have good knowledge on it, but it's always fun when someone is cultured on that. They have one for every single situation, the cultural wisdom.
Just recently, I used, I'm sorry, were you going to say something?
No, no, go ahead.
Just recently, I used it was not a proverb, but we call something the usually the smallest child in a game would be called nohodi, and that would be the extra that would be pulled in case somebody is not doing too well in a game or something, and I use that to help this person express how they always feel like they're on the outside, on the margins of their family or dynamics, but never really fully inside, present as a player. And she was very receptive to that. She was like, she was just, "I'm I'm that chickpea that you said," because it translates into chickpea. I feel like a chickpea. So, that's an example of how I sometimes bring my culture into it.
That's cute. I was just looking at your background and experience working, for example, with Planned Parenthood. I'm wondering if you could talk about that and what sort of experiences you've had there.
Sure. Planned Parenthood was when I was an intern. Um, I don't know if internships have changed now. You had to work and you also had to do an internship because internships did not pay. And I don't remember even how I stumbled upon Planned Parenthood, but I came across it and they were offering training for students. We're talking first grade through middle school on pregnancy prevention, sex education, and Planned Parenthood was providing that. Um, and that's how I became involved in Planned Parenthood. I was traveling to different schools, giving presentations on these subjects from young kids, elementary school to some of the older ones, and some of the format was adapted to the appropriate age, and that's how I became involved in Planned Parenthood. coincidentally, around the same time that I was working with Planned Parenthood, I worked with a program called Children Our Ultimate Investment, and that was a brief experiment with placing young uh, young teenagers to work with children. These are from lower socioeconomic communities. They would have them work with little children, and they would engage in observation, the patience that it required. And that was another way that they developed this curriculum for pregnancy prevention and mindfulness in sexual engagement. So that was the two kind of complemented each other at the time that I was involved with Planned Parenthood.
Interesting. And in your practice, typically, do you see that patient population? Do you only see adults, or do you also see adolescents, let's say?
Only adults.
Only adults.
It's very complicated working with adolescents.
Yeah.
Yeah, mostly adults. It's permissions in their hands to come into therapy.
Right, for sure. And have you had experiences with even pregnancy and, let's say, postpartum depression, or new parenthood, or that sort of complexity in the patients that you've treated?
Yes. I've done some work with that, which is interesting because my pregnancies were always very pleasant. So working with somebody who suffered through postpartum really requires a different level of presence, and you really have to be attuned to the person who's suffering from it. I also have worked with people who have gone through either miscarriages or decided to end their pregnancies. And that also was, for me, a very fascinating area to explore with these individuals because in many ways, it was still something that they kept to themselves. It was shamed. It was something that really brought up a lot of conflict. They would go to Planned Parenthood, for example, and um, or they would keep it secret from the rest of their families or boyfriends or spouses. And that in some ways feels very familiar also to the Iranian community um, that having pregnancies outside of marriage is not okay, or even getting an abortion is really bad. So so that when I see that, I'm always struck by that in the work that I do with these women.
Wow. Yeah, I'm a recent father myself, and sometimes until you've gone through the experience, it's really hard to understand the challenges. And many know that one of the reasons I like doing this work is because of my own challenges of losing my mother at a young age and having that healing experience myself. And I think having the background of going through a difficult experience is very relevant in order to be able to help and guide people in the right ways. And I think when it comes down to the cultural attunement piece, that's also important. It might be very difficult for someone who hasn't experienced certain challenges and certain traumas to be able to hold space in an optimal way for someone who's experiencing hardship of that nature.
Absolutely.
Yeah. Checking to see if we have any questions. Don't. Um, what sort of advice do you have for, let's say, someone who's considering therapy but doesn't really have experience with it? Let's say, there is this stigma. Let's say we're talking about an Iranian man who is reserved. What sort of insights would you give them to try and open them up to such an experience.
I mean, obviously, they come in, you want to know why they're here. You want to know what it is that they want to focus on. Is it for themselves? Is it for the sake of other people? Why are they here? They might say, I'm here for my family, or, I was working with an Indian father um, who was there just for his daughter. He had no issues. He was raised a certain way. He knew where his position was, but then he was just there to support his daughter. Well, he's just there to support his daughter, and his family was so perfect, and he listened to everything they said, and now his daughter is not listening to them. There is immediately a sense of conflict, and and to sort of look for an opening that suggests that they are dealing with some kind of a conflict and they're stuck in it, that the old ways are not really working in the new ways, especially with the next generation or people around them or their spouses, is an area to explore. Um, I think it is important to be mindful of the ego and the status that men still want to hold in a position. But I think it is also important to establish ourselves as a compassionate authority figure in the room, that we're there to help, that we're there to contain it. And we can contain it, and they don't have to necessarily get demoted, but some sense of vulnerability can help them connect with their significant other, their child, or the person they're in conflict with.
Yeah, yeah. This notion of the ego is something that I'm very passionate about. The philosophy of mystic health is that, between the state of full ego and full ego dissolution, there is a healthy balance, somewhere where, this ego is meant to serve us. But if we're only in the ego, and not connected with everything else that's out there, then we're not mystic healthy. And one of the things we aim to achieve with psychedelic therapy is that sense of ego dissolution, especially when we enter, closer to the end of life. The experience of timelessness, of transcendence of our ego, can be really beneficial. At the same time, there is this psychedelic movement now, and a lot of people are pushing themselves in excess, and perhaps doing too much. And so too little ego is also harmful for us and our bodies and our role in society. Um, we only have a few minutes left. I'm wondering if you can talk about substance abuse and your experience with that, and is that something that you've dealt with or seen in the community?
I do see it in the community. Um, Actually, something that really surprises me also about this community is uh, with women binge drinking, um, which says something about the cultural shift, where women are, and also um, the loss of control in that almost. Um, so that is something that actually has been kind of shocking to me to see that pattern. Um, like somatic issues, I always wonder, what is the substance expressing, or what is it that it's quieting, you know? So it is symbolic, when I kind of work with the symbolic value uh, of what's happening in excess. That's what I want to understand. And, what is it that alcohol is offering? What is it that is taking away? What is it that it's soothing or quieting? So that's what I hope to achieve in that conversation. Of course, they need to be at a point in their own treatment, and perhaps, in AA or some of the work they've done, to have some insight into um, their substance use. But yes, I use the symbolic understanding of substances to understand them.
Yeah, interesting you mentioned that because I can think specifically of people that I know, women with strong characters that are having a hard time with the drinking. And it's certainly a challenge. In the case of ketamine therapy, the abuse of ketamine in the sort of younger generation is something that we're seeing more and more of. And I'm very careful on who we offer ketamine therapy to, because even though there's evidence now that ketamine assisted therapy can be useful for alcohol use disorder, there's also that risk of creating a new dependence. Ketamine is a very powerful substance, and it can bring a lot of relief from suffering that's often been there for many years. And that's why when it's not done in the right container, then people can keep seeking that and replace one bad habit with another. But I'm hopeful that through this collaboration, we can be a positive influence on our societies and to do this work. I'm really proud and happy to have you as part of our team, and look forward to treating patients together.
Same here. Thank you very much.
Yeah, thank you for all the wisdom, and thanks for joining everyone. We will be putting this webinar on YouTube. At mystic.healthy is our tag, and see you again soon.
Thank you for having me.
Have a good night.
Have a good night. Goodbye, everyone.